Our next healthcare career is perfect for individuals who are inquisitive and like to use technology to diagnose problems. If this describes you, a career in radiology and diagnostic imaging might be the perfect fit. The team at Wilson Medical Center in Neodesha shows us what a career in radiology and imaging has to offer.
Hi, my name is Erica Johnson, and I'm the Director of Marketing at Wilson Medical Center. For generations, our hospital has been caring for people inside this community, and one of the most powerful ways we can do that is here in our radiology department. Radiology is where our providers can look inside the body without a single incision. It's where problem solving meets technology and where answers begin. If you're curious, you like science, and you want to help people make a really large impact, then radiology just might be the healthcare career for you. Let's take a look.
I chose radiology because when I was young, I worked in a hospital and I was a candy striper as a volunteer. And I got to walk patients from the beginning to the very end. And I would walk the patients to radiology and they would be, you could tell they were scared. I wanted them to feel comfortable, and just watching the patients go through there, and by the time I left them, making them feel more comfortable and at ease. I knew it was something I wanted to do, at least in the medical field. What I love most is when the patients come in, they may be worried about finding out if they have cancer or what disease they have or just the unknown. And once they get here, helping them feel comfortable, helping them know that I care, I truly care, and that when they walk out that door, they know someone cares and made a difference in their life. I had a patient get smashed with a cow up into a fence, and his bones were sticking out of his legs going different directions. So you have to think outside of the box. How do I get these images for the doctor? You can't do what you normally do because bones are going everywhere. So it's fun and it's more intriguing to me because you definitely have to figure out how can I get 2 views of that body part to get to the radiologist to be read. So to me, it's challenging, so I like that part. Nowadays, there's a lot of students that are getting their associate's degree while they're in high school, which is great. Highly recommend it. But make sure you get the prereqs you need for the program. And then your program can be 2 years, and you will need to be registered with the ARRT, and you will have to be licensed in the state of Kansas. Some states do not require you to be licensed, but in Kansas you are required. So if you want to go on farther, you can get a bachelor's degree and do it in 4 years. But 2 years is the minimum. It's a lot better than being a doctor and going 8 years. There's really good money in radiology. There's high demand right now in radiology. So 2 years, a little bit of experience, high demand, guaranteed to get a job. Science, math, any A&P classes. A lot of people think that going into radiology has to do with just math and science. You don't have to be a pro at math or science, but you've got to have some basic knowledge of problem-solving skills. So if you're not perfect in math or science, no, you're still going to be okay. Someone who's calm under pressure, that can handle stressful situations, and someone that likes to take care of patients and not be by their bedside all day like a nurse. Like a nurse, they're with the same patient all day. We get a love on our patients for a little bit and then they're out the door. Radiology can see inside. The doctors can't see what's inside. They can guess what's going on inside with that patient, but we get to see exactly what's going on inside that body, different than anyone else, which is really fun. You never know what you're going to see. So the future of radiology, I just see it being able to diagnose patients so much quicker. When I started radiology, we had a single slice CT machine. Now they go all the way up to like 640 slice CT. So being able to catch that tiny little cancer sooner, anything with mammo, little tiny things, lungs and CT, just the advancement of all the equipment's going to make diagnosis so much quicker and scans faster, less radiation to the patients. The advice I would give a high school student is job shadow, 100%. Don't just do it in one place. Go to the hospitals, ask if you can job shadow, watch everything from A to Z. Don't just do it quick and think I'm done. I mean, I really think you should go in, watch everything, ask lots of questions.
We hope you enjoyed our radiology department today and a look inside of all the different modalities. From CT to X-ray to ultrasound, there are a plethora of modalities to choose from. But we want you to remember, no matter what career path you choose, choosing one in healthcare will make a lasting impact.
I want to welcome our next panelist from Wilson Medical Center in Neodesha to answer questions about career opportunities in radiology and imaging. Joining us this morning is Shauna Schaefer, Director of Radiology. Good morning.
Good morning.
Thank you so much for being here. Your video answered so many of my questions. Lots of great questions answered in your video, but I was wondering, is every day about the same in radiology positions, or do your days vary a lot? Like, what does a typical day look like?
Oh, every day is different. You may walk in one day and have a stroke patient in the ER, and right after that comes in a trauma patient. So you have to be able to handle situations like that. And some days are just really slow and you get bored, but you find things to do like cleaning equipment and different things like that. So no 2 days are the same.
That's good, because we know there are folks out there that like that variety.
Yes.
What about the career ladder in radiology? Like, can imaging professionals grow into different leadership positions or advanced specialty roles? Tell me a little bit about the opportunities as a career.
Absolutely. You can start in just general radiology, which is just taking black and white images, looking at chest x-rays, broken bones. From there, you may want to advance into like CT, where it's like taking slices of your body, and the radiologist is able to see an individual slice to see tiny little tumors. You can go from mammo on up to leadership into maybe you want to be a director of just our PACS viewer. I mean, there's all different areas to go in radiology. You can start at the bottom and work your all the way to the top.
And you mentioned job shadowing, which I think is so wonderful. We want to encourage everybody watching today that if you're interested in a career, that's the greatest way to get in. And I think, did you say you also did job shadowing too when you were thinking about a career? Is that right?
Yes, I did. Job shadowing, you can go in, follow all the different modalities and see what you like. I also was a secretary for radiology, and that helped me realize that's what I wanted to do. But job shadowing will give you the idea of, is this something I want to do or not?
Yeah. Well, I think people also like, how do I get started with that? They can just reach out to their local folks that work in healthcare and probably get that connection. Is that right?
Yes, we have schools call all the time saying students want a job shadow, and we love that. We bring them in, take them around to all the different modalities, take them to pain clinics, surgery, and just show them what a day could be in radiology.
That's great. Well, I could ask more questions, but I know we have a lot of folks online that would have questions in this field. So, Jaron, what kind of questions do we have in the chat?
Yeah, thanks, Cindy and Shawnee. You did answer some great questions, but it's a very active chat. So let's get to as many of these as we can for the next 10 or so minutes. So on this last point of there are different modalities you can pursue and whatnot, what does that extra training look like to work in specialties like MRI, CT, nuclear medicine after completing a rad tech program?
Well, in the rural areas like where we are, it's on the job training. You could come in and complete your 2-year program for radiology, but we all wear multiple hats and can get on the job training. If you choose to go to school, there's schools for nuclear medicine, MRI, you can get your certification for each one of them, but there's a lot of on the job training.
Another question we have from Jim is, are there ways that somebody should prepare, or what should they expect to, or I guess before they are starting a rad tech program?
What to expect? Every day is different. Every day is fun. If you love patients and you'll love your job, your employees become like your family. You're there so much. So every day will be a great day. I love my job, and I'm sure they would too.
Great. All right. Another one from Amanda. What are your typical work hours? And again, are you working on weekends and how does that vary day to day?
So luckily, we have a weekend tech right now. Before we took call on the weekends, but now we have a tech that works the whole weekend. We have techs that work 10-hour days, 12-hour days. We have learned here in rural America that we make it fit to our employees to keep our employees. And so trying to get rid of as much call as we can has really helped us.
No, that's a great point. And many people we know are looking for that work-life balance. So that's a great point to hear. So another question we have from Faith, what are some of the medical conditions that you are either seen most often or in general that you can detect from the different types of scans that you see in the radiology space?
Mainly, I would say with CAT scans, we see a lot of tumors, a lot of masses. Um, That's the hard thing about radiology. You see these things and you have to not show that on your face to the patients. When you're doing a scan, it may pop up with the liver mass or a kidney mass, and you have to be able to not let that patient know you know what's going on.
Yeah. And so another one here, so more on the technical piece. So are some of these radiation, or I guess machines, I should put it, for that involve radiation? This is from Addison. Does it harm the body? And maybe what is that threshold? Do you need to be considering how many scans somebody's receiving?
So when we in the field, we all wear radiation monitors. We try to stay back as far as radiation. CAT scans are the tests that give the most radiation. So we do have a lot of cancer patients that come in every 3 to 6 months. The benefit is worth more to know how to treat them. So yes, there is radiation, but the benefit outweighs the risk.
Okay. Another question we have from Addison, how stressful is radiology and maybe, a comparison with the emergency room? What kind of a pace are you looking at in some of these situations?
I've worked at different facilities. I worked at a facility where I was in the ER, the only X-ray tech in the ER, and you were busy nonstop seeing a lot of different things from heart attacks, strokes, broken bones, to seeing a lot of different things. So yeah,
It can vary. All right. A
it can
question
vary.
from Winter. Is radiology more of an individual or a teamwork field?
It's actually both. You have to be able to work with the team. You have to work with the ER doctors, the nursing, the staff. If you're in surgery with the anesthesiologist and the surgeon. And then when you're by yourself, you got to make sure you take good quality images. And when you see that images, know that you have all the anatomy you need. So you're on your own, able to answer the patient's questions, ensuring you've answered everything. So it's a little bit of both.
Okay. Another one here from Tina. If she is interested in doing cardiac sonography, should she generalize or specialize first?
I would say specialized. That is in such a high demand right now to specialize in ultrasound and echo. Not too many techs want to do that. It's harder, but if you have the desire for that, I would say definitely specialize in that.
Okay, well, that's a great takeaway. Another question from Hawker Grove Middle School. How expensive is the equipment that you work with?
Oh, $1 million. Nothing is cheap. You learn, do you want to take care of it because you're going to have it a while?
Yeah. What is the most expensive machine that I guess is out there in the radiology space?
Probably nuclear medicine, CAT scan, PET scans, any of those bigger machines, but they're all expensive.
Yeah. All right. Another one here from Macy. Can you move up to an X-ray technician from a diagnostic medical sonographer over time?
Yes, I've had techs actually do that. Usually it's from X-ray to sono, but yes, they can do that.
Okay. Great. Let's see here. Back on maybe the numbers here, just to give an idea. Stacy's wondering how many X-rays per year can an individual receive? What's healthy?
I can't really tell you the amount of X-rays. X-rays definitely less radiation than a CAT scan. I don't think anyone needs to worry about how many X-rays they're gonna get for their lifespan. You'll be fine.
Okay. And then a couple more here as we're getting close on time. A question, is it difficult to be a radiologist or working in the radiology team? And let's also put in here, what do you find most rewarding part of your job, but also what are the challenging aspects?
I think the most rewarding thing is we have providers order tests. They're kind of guessing what could be wrong with the patient, looking at symptoms. We're able to see inside that body and help them diagnose and treat their patients. So that's very rewarding.
Great.
Sure.
All right. Well, let me make sure here I think that covers a lot of what we have. And so for the sake of time, Cindy, I will turn things back to you. But Shauna, thank you so much.
Thank you.
Oh, thank you so much, Shauna. So many good questions. Your video answered a lot, and I appreciate all the students' questions as well. So we want to thank you so much for joining us and sharing your insights on a career in radiology imaging.